Now, BRICS will hold its 15th Heads of State and Government Summit in Johannesburg. It will run from the 22nd to the 24th of this month. Leaders of the major economies are going to unpack ways to improve economic ties between their diverse countries. As a build-up to the BRICS Summit, the Numolux Group recently held a series of international health seminars titled BRICS and Africa, African Solutions to Africa's Health Challenges. Anton Arendse is the CEO for the group, and he joins us for this conversation. Anton, it's not only a timely conversation because of BRICS, but I think there's been so many lessons learned coming out of the COVID-19 pandemic that there's never a better time than now to actually look at what are the vulnerabilities that the African continent, and in particular the BRICS groups of countries that are seen more as representing the South in terms of, international relations, what it is they can do to start beefing up the challenges they faced under COVID.
Good evening, Kathy, and thanks for having me. A very, very interesting comment and point that you make. The lessons learned over the past 2 years has brought into sharp focus the need for developing countries, and particularly the global South, to ready itself for the next pandemic and to be fully prepared for when that happens. And part of that preparedness is a far more deeper collaboration within BRICS countries and then also on the continent of Africa. It might be useful to know that while during COVID, and we're not going to get into the debate of vaccine hoarding, while that was happening on the one side of the world, you had specific countries and companies within China specifically who had vaccinated more than a third of the global population. Now, the global population, I think it's important to note that. So, really, there ought to be less ambivalence within the BRICS community in particular around how we need to collaborate and collaborate a lot more closely in the lineup to not only post-BRICS, but more specifically in the health space, how we deal with epidemics, pandemics, and those illnesses and diseases that continue to plague the continent of Africa.
Of course, one of the expectations that comes with countries being part of a bloc of this nature is that, there'll be a level of generosity amongst the parties, that perhaps there'll be a little bit more information sharing, maybe even, intellectual property sharing. Are we seeing that to be the case, especially when it comes to health, because that is a very competitive industry globally?
Mm-hmm. Indeed, I could not agree with you more. Look, at that level, there are two specific areas that I believe in the health and pharmaceutical space particularly. There is the need for traction to be given to a few things. The first is in the area of expediting medicines, pharmaceuticals, medical devices within BRICS communities, as well as then to the global South. In this regard, there are relationships and institutional relationships, just by way of example, within the regulatory health space that absolutely needs to be established. That in so doing will begin to expedite the approval of new medicines, and by expediting the approvals, we then also increase access to lots of medication that is already available within the BRICS community. So that really is the first area that I do believe we do need to place a lot more emphasis on, a closer collaboration within the regulatory environment. The second area really relates to the area of taxation, of tariffs that we really do need to look at between BRICS communities, so that in the area of health security, we're not impeded by having to pay these rates and tariffs in order to get access to medication. And this cuts both ways within the BRICS community, as well as the spin-offs to those who are on the fringes of the BRICS countries, particularly on the African continent and more broadly within the G20. The last area that I do want to add, Kathy, this relates to within the BRICS Business Council. There are a number of streams, and I am aware that there has been discussion around establishing additional streams, and really for us it's really to amplify the clarion call for there to be a dedicated health working group within the BRICS Business Council to deal specifically with the issue of expediting medicines and medical devices within the BRICS group.
One of the things that has also come out, I think, from the collective engagements you've held is the issue of skills, and in particular, a shortage of skills when we're looking at countries such as South Africa. I wonder, when it comes to addressing the issue of skills shortages and how that can be improved, we're dealing here fundamentally with countries, yes, that represent the global south, but that also have very different challenges or different types of challenges, even when it comes to the question of skills. How do we address that so that it's beneficial for all parties or partners that are part of this grouping and not just some?
Well, a slightly different view on this one, Kathy. It's not that as a country, South Africa has a lack of skill. One should really be talking about the exodus of those skills, and then understanding why the exodus of those skills. That, I believe, is a discussion that that is in fact a discussion in itself. What I think at this point is important is to stress that as BRICS countries, there needs to be an environment created that provides the incentives for those skills to remain within BRICS countries. And then if we're talking about South Africa, for South Africa, both at a public and at a private level, to create those conducive environments for those specialist skills, for those clinicians and supporting services to remain within South Africa. And in that way, we have less of an issue around skills being lacking in the country, in the continent, and in the South.
All right, we'll leave it there for tonight. Thanks for your time. Anton Arendse, the Chief Operating Officer of the Numolux Group.